Hey moms, when we know better, we do better, right? Well, that's our mission. This is Momcast, powered by the Local Moms Network. I'm Dimitra Ganius, coming to you from Stanford Studios, and I'm so happy we're in this together. Moms, we have so many partners in raising our kids, and perhaps the most trusted should be our pediatrician. Well, today we're getting answers to some of your most asked questions from the one and only Dr. Mona Amin. She's the pediatrician that millions of us follow on social media, and you know her as Peds Doc Talk and the host of the Peds Doc Talk podcast. But before we get to all of your questions, we wondered, how did she get here to being the voice that we turn to on all things kids?
So I was working at a very busy practice where I had maybe 10 to 15 minutes max with patients sometimes before someone was knocking at my door to see the next patient.
Oh, wow.
And I was like, I need more time to explain the things that I want to explain. Or a family would say, wow, what you just explained to me, no one has ever explained it that way. Is there anywhere I can go online that I can get that same information? And I said, no, because no one can speak how I speak. So I started an Instagram account in 2019, March of 2019, and I just started posting based on what I was seeing in my office. I would do car chat videos on IGTV, which was like the old school form of like Reels.
Yes.
And I would just shoot videos and do posts when it was simple Instagram, and based on content that I was seeing in my office, interactions, and also based on what my community online was seeing. And it just really blossomed through the pandemic, through just, my love and desire for the whole family unit. I always talk about parenting, but I also talk about mom, dad, how to better ourselves. So I think, people have really gravitated towards that relatable, personal approach to pediatric health development and parenting. And I'm just so grateful for all of it. It is a privilege and an honor to have this sort of power in terms of being a larger platform to educate and inspire families around the world. And so really grateful for that and to be here.
Yeah, it makes a lot of sense, and you become such a trusted go-to. And that's a lot of responsibility when people come to you for facts. I want to get, if we can, an announcement about what's next for you or what's happening, because I know there are changes happening in your career and we'd love to know what's going on.
I have been the medical advisor for an online telehealth company for the last year in 2025. Okay. And we had dreams of me joining them as their chief medical officer, maybe down the road. And they approached me in the end of 2025 asking me to join them as a reduced hour part-time CMO, so chief medical officer. And honestly, it felt like this full circle moment. And if anyone's not familiar, a chief medical officer oversees all of the medical aspect of a practice, and in this case, the telehealth practice. So we go over protocols, we train the staff, we look at quality control, meaning chart reviews, looking at the patient experience, looking at the clinician experience, basically making sure that we're creating an amazing experience for both the consumer, so the patient and their families, but also the clinical staff. And so I'm joining them, Poppins is the platform, as their chief medical officer. And part of that, what was important to me is that most CMOs are doing this maybe 20, 30 years in their career. I'm 10 years in my career, which I have a lot of experience. 10 years is not nothing.
Right.
And it was important to me that I also continue to see patients through the platform.
So, Dr. Mona, you're still going to be, of course, on social media educating us.
Yes.
But I think it's so interesting that it speaks to what a mom can do if she pivots, and we don't see the opportunities coming all the time. Talk to me about your family and how this all works, because I know people will say, you wouldn't ask a man how they do their career being a father. And I say to them, well, I would. If I talk to fathers, I do ask. So I'm going to ask you that question because I know moms are curious. How do you pivot? What about a second act, maybe a third act or a fourth act? What does this mean for your family, and how are you doing this all? Because we're inspired by you.
Yeah. And so I will say, I never want to discount what I've been able to do without help, because I have been able to build a lot of Peds Doc Talk without help. But that was at a sacrifice to my mental health. And I want to be clear about that. So the answer to that question is I am able to do what I'm doing because I have good help. And that includes a husband who supports what I'm doing, And he also works full-time as an ER doctor. But being an ER physician, he has shift work. So whenever he's off, he's able to pick up the kids or he's able to do the grocery shopping. He does all the cooking. We've divvied up responsibility so that I'm not taking on the brunt of the female duties in the household, and he takes on equally as much as that. And I mean, I use cooking as an example because that can tend to be the female-oriented task, not in every household, but it can be. But he does all the cooking.
It's the bane of our existence in a lot of households.
Yeah, and I will be honest, when he's not home, so when he's working, I either have meal prepped food, which is leftovers, I get takeout, or I take the kids out because that
Amen
is not,
to that. I love all of it.
That is not on my radar, and I delegated that to my husband. And so I also have a nanny right now who has I show her a lot of gratitude. I'm very clear on this, that whenever I sign a large partnership with a brand or something that is financially stable for my family, I increase her salary. So she gets raises every time I do well. And I've told her this, that this is
that's
because
such an interesting thing.
Yeah, I do this because obviously nannies don't expect raises in random parts of the year. But if I do well, she does well, because I can't do what I do without her help, without her ability to watch the kids if I'm traveling and my husband's working an ER shift. So she's growing with me.
Thank you so much for doing that.
Yeah.
And I think it's refreshing for women to hear. And it just reiterates that, yes, there are so many layers to our success. I'm going to start with the most tricky question we get, and let's just dive right in. People want to know about vaccines. Moms, dads, we have so many questions. And the truth is, we're not going to convince anybody here, right? If you are, for lack of a better term, an anti-vaxxer, I don't think Dr. Mona is going to convince you in this moment. But I want to have a genuine conversation out of curiosity. What is your stance on vaccines and why they're so important for kids? With the eye on, can we do things any differently than they are prescribed by pediatricians and the hospital when our baby is born? What's your take?
So I love this. I love this because it's important that we understand terminology of what you just said about vaccine, anti-vaccine, where I'm at and stuff like that. So I have changed a lot of my viewpoints as I've practiced medicine. So when I first came out of residency, it was, you got to get the schedule. And if you don't get the schedule, you're a bad parent. And I want to be clear on that because I've changed in the last 10 years of practice.
Interesting.
I still strongly believe in the power of vaccines. And I vaccinated my own children against everything that we can get from the routine schedule, and I do it on the schedule. But I also now have understood parents' curiosity and parents' questions. And so when we talk about the terminology, there's pro-vaccine, which means give me all of them, whatever it is, I don't care, I'll take them all. Okay, and that is a large portion of parents that are in my community. Then there's the anti-vax, and these are people in my terminology that have decided I'm never getting any, and I'm going to spread misinformation about those vaccines. That is a small group, but it's a group that exists. But then a larger group of the vaccine hesitant families are the ones that are like, I've heard these things about vaccines. I'm not sure. I want to get them, but I don't know if I want to get them on schedule. That is the large majority of people that are coming to me for questions. And that is the group.
I just want to reiterate that term because I've never heard that, and I think it's so interesting. Vaccine hesitant.
Yes.
I love that word.
It is the large majority of people online. And I think we group them into we group those people into anti-vaccine. And I think one of the huge disservice that a lot of pediatricians do is they think vaccine hesitant families are automatically anti-vax. So the moment a parent asks a question, well, I don't know, like they look at the partner, right? So I've had the situation where the mom and dad are there, and then I'm like, okay, so today we're getting, your pediatrics and your rototech and, your rotavirus, and the polio or whatever vaccine and the pneumonia. And they look at each other. And I already know that I sense that there's dissent. And I'm like, tell me more. Like I'm a good reader of the room. And I'm like, what are your questions? They're like, I don't know. Like I've heard things. It's very easy for a pediatrician to say, okay, well, look, you got to get this. It's required. Or, if we don't, you have to sign a form. And that already comes off, whoa. Like I'm just asking questions. So I think what we have to understand is that how are we going to reach the vaccine curious or hesitant families? Okay. These are families that are not pro, not anti, but just want answers. And so that is how I've changed. I will be honest. I am very pro-vaccine, leaning vaccine curious. What I mean by that is I ask a lot of questions. When you talked about the schedule, there's a lot of question on should we redo the schedule, right? Do we need the Hep B birth dose? When a mother has been tested and is negative for Hep B. I have already been giving guidance to a lot of my families with prenatal care that if you don't want to get the Hep B at birth, you can wait until you come into my office or get it with the combo vaccine at 2 months. This is guidance that I've been giving. My son and daughter both got the Hep B birth dose because I believe in it. I don't have any fear about the Hep B vaccine because I've seen it given. But I have many families that are pro-vaccine, or maybe that vaccine curious that didn't get the Hep B at birth, but they got it with the routine 2-month vaccine because I want that child to be vaccinated. Do they need it at that time? Debatable if it's,
Right.
if they've had good prenatal care, but I use that example. Another example is with the rotavirus vaccine. The rotavirus vaccine is given until 8 months. And if you haven't gotten it at 8 months, you don't get it at all. And that's because the most risk is in that infancy period. So I have some families that are like, my kid's not going to be in daycare. They don't have any siblings. Is it okay if I don't get it? I'm okay with that. But the bottom line is I'm having conversations with these families. I will always tell my families, I want you to get these vaccines because I believe so strongly. But if you told me that you wanted to hold, or if you told me that, I want to wait, I don't want to get it, I'm going to tell you why I don't really love that decision, but I'm not going to be mad at you. In the end, all of my families in my office have vaccinated, whether it's on the routine schedule or on a delayed schedule that we have come up with together based on their comfort. My comfort is giving the routine schedule, but I have created random schedules for my families to appease them because in my mind, I'd rather have a family vaccinate on their own schedule than not vaccinate at all.
Not do it at all. Yeah.
And that is my philosophy. So to answer your question, my kids have all gotten the routine schedule. They get the flu vaccine. They do not get the COVID vaccine. And that is because we don't vaccinate against COVID anymore either. I've been very vocal. Not that I think COVID is harmful. I just have personally felt that the benefits don't outweigh the risk, given that kids who get COVID now with the strains that are out there are not having poor outcomes compared to 4 years ago.
So you're saying you're no longer recommending a COVID vaccine for kids?
I don't personally get it, and I advise my families that with a shared decision making. So we discuss what's in the family, who's in your family, what are your concerns about COVID? Let me tell you about that. And we make decisions based on the family. So some of my families in my office have gotten the COVID vaccine. Some are like, you know what, my kid has gotten COVID 4 or 5 times and they have fared well. So then we make a decision not to get the updated boosters. So that is a shared decision making that we make. But that actually goes against, again, a lot of the AAP guidance. But I'm not anti-COVID vaccine. Let's discuss what makes sense for your family and make a decision there.
I can appreciate that thoughtfulness. And that takes me to the flu shot. I have to say, I've had a bad track record myself, only because some years we have gotten vaccinated for flu and then we end up getting the flu anyway. And that makes me throw my hands up as a parent and say, well, then why am I even doing this? Because I know I'm putting something into my child that wouldn't necessarily be there otherwise. And is it true we're sort of guessing at the strain? Because to me, that's the biggest argument for, well, hold on. If we don't even know what the strains are, why are we doing this? What's your take?
So funny because I like to explain how my views have changed. So this was a situation where I grew up in a household where my parents never wanted to get the optional flu vaccine. I had a mother in healthcare and we're Indian. And I say that because they're like, oh, your body needs to build immunity. So I grew up before medical school, never getting the flu vaccine. Okay. I went to medical school, went to residency, and then I just saw what the flu can do to a healthy individual. So when you see that, it can't leave your head. Like it can't leave your head that, oh my goodness, this was a healthy individual that was running marathons, or a healthy child that was doing well that is now intubated in a hospital because they didn't get the vaccine. And that is what changed my mind. That is what made me become not anti-vax because I wasn't spreading lied, but more so like, you don't really need it to, I really recommend this vaccine for your child.
Really?
And so,
okay.
Yeah, and so that is how I changed.
How common are those extremes though when you talk about, these very severe cases of flu and what they can do?
Obviously, it's going to be less than 3% of the population that gets, that obviously is not vaccinated, but that is really when you think about how big a population is, that's still large, you know? And so when you look at the benefits outweighing the risk, I also want to go back to that terminology. Every vaccine, I always weigh benefit over risk. And what that means is giving this injection or syrup or whatever it is, or nasal, is it going to provide more benefit than the side effects of the vaccine? So with flu vaccine, you may get a little runny nose, you may get body aches after the flu vaccine, but it does reduce the risk of hospitalization. It does reduce the risk of complications, including pneumonia. And this is stuff that I've seen. When you look at the data and when I see in clinical experience, I have seen families that come in and I look at the kid, I'm like, ooh, your kid doesn't look well. Did they get the vaccine? No. Or I see a kid that looks kind of borderline flu, and I'm like, yeah, it looks bad, but not that bad. Did they get the vaccine? Yeah, they did. So even with the vaccine, we see better outcomes. So that's why I'm very pro flu vaccine, because I do see that the outcomes are better, meaning, yes, you could get the flu because it's not 100%. You said it beautifully that they're predicting what strains may be circulating. They can't always know because the virus is always changing, similar to COVID. COVID is always changing, right? The thing is they've gotten better technology with the flu than they have with COVID because flu has been around longer. So in maybe 5 years, COVID vaccines will be better in efficacy as the flu, but it's never going to be 100% because both of these viruses are ever changing. And so when you look at the flu, it is still maybe 60 to 70% effective. And that's not 100%, but it's still better than none. And I just see flu cause way more problems for kids than the COVID vaccine, than any other, seasonal vaccine. So I'm just like very pro flu because I just don't want that risk of like, we don't know which children are going to be affected. We just don't know. And that is a hard reality.
And I like hearing that your opinion is based on what you see rather than, studies that are out there somewhere. It's what you're seeing in your practice day to day. Once and for all, tell us, is there any connection between vaccines and autism?
So I want to be clear that we have no research between MMR and autism in the very good research that we have. MMR is the vaccine that was in early 2000s was, vilified to be the cause, which has been debunked by multiple studies that are available on the AAP website and also in my vaccine guide. I want to be clear because now the government is looking at connections between the infancy vaccine schedule and autism. And so now they want to look into aluminum and all that. We have some data that shows that certain vaccines, meaning your DTaP, your polio that is given in the infancy period, don't have any connection, but we don't have the combination of the schedule and the data showing that there's no connection. We're not worried because we know that because we've done other studies that we're pretty much in the clear here. And what we know about vaccines and also what we know about autism, we're very confident that even if they were to do studies, it would show that none of it is causing it because we know that there's a genetic component here. But I want to be honest that do we have a good study that shows the entire vaccine schedule in the infancy period does not cause autism? No. But the data we do have shows that we're not concerned about that autism is such that it's a genetic link, that families, have a mutation that can be passed down, or a family member has it and then the child has it. And the reality is autism presents itself in that toddler years, and that is why a lot of vaccines get vilified because the toddler years is when all those demands of social language learning come into play, and that's when you start to realize autism. We can't diagnose autism in the infancy period. It's way too early, and that is why MMR got the bad rap, is that is one of the vaccines given at the 1-year visit, and Andrew Wakefield, who kind of led the charge of the MMR autism connection that was later debunked, vilified it, said that was the cause. And people started to say, well, yeah, my kid got the 1-year vaccine and then 6 months later they were diagnosed with autism.
Right.
That wasn't the vaccine. It was the fact that in the toddler years, that is when we see autism start to present itself. And your child likely had autism all along. It's just that we didn't see it yet because of the fact that they didn't have the social and language demands until they reached toddlerhood. I
want to change topics a little bit and go to how do we get a clear and unbiased diagnosis for ADHD? And when you see hundreds, thousands of children, how do you know what is typical girl behavior, boy behavior, and what makes you say, let's go for some further testing?
I love this. And one of the biggest things is knowing that general pediatricians may be experts at areas that they're very passionate about, but they may not be experts at everything. And I say this with being a pediatrician. Like, I love child development. It is my bread and butter. I love it. It's what I shine at. I may not be the best person to manage asthma. And I say this with honesty. Like, if I'm getting a complicated asthma patient, I may be like, yeah, this, but you know what? I'm going to use my pulmonologist friends because I'm not an expert in asthma and allergies, but I know a lot of people who are. So I say this because your first go-to is going to be your pediatrician, right? Because that is your first line. You're going to ask your pediatrician, how comfortable do you feel on diagnosing and managing neurodiversity ADHD? If they're not comfortable or they give you a wishy-washy answer, your next options are psychologists that are trained in that. They're going to be neurologists that are trained in that. And you can ask your pediatrician, who do you think, if it's not you, is the best next step? I give the example that with ADHD, I'm really good now, after 10 years, at diagnosing ADHD, getting autism, diagnosis on the docket here. But when it's an ADHD, complicated ADHD, or someone where it's like anxiety and ADHD combined, or maybe OCD and ADHD, I'm going to utilize my colleagues who are psychologists. And it comes to understanding the limitations of the provider in front of you, and that provider also needs to have some humility and understanding of what they're good at. And so it's a combo. It may not be across the board that every pediatrician is going to have the same knowledge. So go to your pediatrician, ask them what they feel comfortable diagnosing and what they feel in terms of the management of ADHD. Because like you said, girls can fall through the cracks. Many times it's because girls have inattentive ADHD, and inattentive is not that rough, the class clown. It's the one who's like daydreaming in class. So, and they could still very well do well in class. And so they can fall through the cracks because they're not the loud, boisterous, person that's disrupting, but they're having difficulty focusing and with material. So it's trying to get those deeper questions, not only using the questionnaires that we give to families, which are the Vanderbilt questionnaires, but also tell me what you're noticing. Tell me what you are feeling at home, and also the school system saying, because with ADHD, it's both.
It's both, yes. And I know, some teachers, for example, can have different standards. So in one school, my child might be, flagged for having certain symptoms, and another teacher might say, no, this is classical, this behavior. I've seen this before. So, and I think that's why I said unbiased, because when the human element comes into a diagnosis, it's really hard. But I appreciate what you're saying about just get more opinions, because even if your pediatrician says, I think you should go get a second opinion on this, or I'm noticing this, it doesn't necessarily mean that something is wrong. It just means more eyes on my child. And that actually makes me feel better.
I agree with that. And I think there's I don't think it's as much now, but there's been a switch between stigmatization of getting a diagnosis to now this feeling that people think that everyone has ADHD or autism. Like, it's gone like, are we over-diagnosing? And to be quite frank—
Yes, the pendulum has totally swung the other way, it feels like.
I'm going to be honest, I have always felt that most of this world is neurodiverse. When you think about it, all of our brains are diverse, right? So when you think about, society has created this sort of neurotypical is what fits the society norms, right? That is what neurotypical is defined as. So why are we defining neurotypical as what's socially normal, right? That's societal standards. If we just said everyone is neurodiverse and we all think differently, we all process stimuli differently, everyone in essence is neurodiverse, right? Like when you go down to the fundamentals. And how I see this is that I have noticed a lot of families coming into my office whose children are getting diagnosed with autism, ADHD, and then the parent is like, you know what? I have it too. And it could be high masking or low intervention. And I go back and I'm like, I think it's because you were masking your entire life, and you probably had anxiety that was manifesting. All of your ADHD or autism was actually manifesting as anxiety because you just couldn't be yourself. You were living in a world that was neurotypical, that didn't accept the way that you learn differently or that you socialize differently, and that's going to cause
and you changed yourself to fit into a mold. Right.
Like, are you sure your social anxiety wasn't autism? Are you sure your social anxiety wasn't ADHD and you just wanted to always butt into the conversation because you had hyperactivity? And maybe you've created this label of social anxiety because people told you that you don't have normal social skills. Like, it's a very interesting world that I'm diving deeper in and learning more about. But I have talked to a lot of families, and at parties I'm a lot of fun because I'm like, you know what, like, and we talk about
Let's
this.
talk about it.
You know, like families, like parents, like, you know what, like that makes a lot of sense because I have really, in social situations, I started to drink and mask that because I think I have low intervention autism or high functioning, ADHD. And I have just been masking that my entire life. And now my daughter has ADHD or autism and I can't mask it any longer. And I've talked to so many families that are like, I have turned to substances, whether it's alcohol to numb it. And I realize now that my mind just thinks differently. And I don't want to talk to so-and-so because I just don't want to talk to so-and-so. And I think we're doing our kids a huge service by understanding neurodiversity and getting them diagnosed so that we can better serve them. It's not an excuse for their behavior. It's not an excuse for them to be rude or dismissive, but it's an understanding that my kid's brain wires differently and they are going to be more sensitive to noise, to authority, to all of that. And I, as a parent, it's my job to now know how their brain works and better parent them so that they don't feel scared or vulnerable or upset in a world where their brain is thinking differently.
I appreciate all of that. And I, as parents, we're constantly learning through our kids. They are our greatest teachers. And I know this is an area in which that's particularly true. I want to ask about precocious puberty. There are so many headlines about girls getting their periods sooner. And is this something that is just magnified, so we're hearing more about it? Or do you think it's true that most girls are going through puberty earlier and it's because of something we as parents are doing or the lifestyle that we're creating for them?
There's a lot of research still going on into this area, but it's not any more than it has been in my entire career and in generations past. Meaning, It's not like all of a sudden we're dealing with the precocious puberty epidemic outside of these factors. So we are seeing a rise in precocious puberty because of increased childhood obesity. So in that population, in the population that is having obesity, and this has to do with lack of exercise, diet, right? So if you're having obesity risk factors as in the childhood period, you are more at risk of precocious puberty. But the risk of precocious puberty is not higher in children who are not obese. So that is the differentiation here.
And what is the time period we're talking about for precocious puberty? What is considered early and what is quote unquote normal?
So for girls, this means that you're seeing signs of puberty, so breast buds before the age of 8, and in boys before the age of 9, so testicular enlargement before the age of 9. And so that's considered precocious because for females, your thelarch, which is the breast enlargement, breast buds, is going to be that first sign. And then for boys, it's the testicular enlargement. So 8 for girls, 9 for boys. So that's really early. But I want to be clear that in the general population, I'm talking non-obese population of children, there's not been an increased rise of precocious puberty. So there's not this weird epidemic. But we are seeing an increased rate of childhood obesity. So thus, the increased rate of precocious puberty, right? But as long as you are eating a well-rounded diet, you are not just doing processed foods all day, every day, you're getting exercise, I'm not concerned about that. Also, I'd like to add that family history plays a huge role. So if a mom went through puberty at 10, there's a chance that her daughter is going to go through puberty 10 or early as well, because genetics play a huge factor. So it's not so much as like our environment is toxic and that everything's a problem. It's that obesity is a risk factor, and we are seeing higher risk of childhood obesity, especially in America, and that is not something that we're denying. And that has to do with diet, lack of exercise, processed foods, things like that. But we're not seeing the precocious puberty rise in the general non-obese population. So I want parents to feel reassured that it's not like this hidden plastic in your food that's causing your non-obese child to now get early puberty. To go into that point,
I think we hear a whole lot about the foods that we're eating, organic or not, about pesticides, about plastic, about toxins. I think parents can get overwhelmed and say, I'm doing everything I can, but there's always something else. And I feel like I'm responsible for this unnatural maturation in my kids.
And I think that's a valid point with the plastic comment, right? Microplastics is an area of huge research. And when it comes to an area that is still not closed off, what I mean by that is we can say with certainty that maybe We know like vaccine, MMR doesn't cause autism. Let's use that as a certainty because we have enough data to support MMR does not cause autism. But in this situation, do we have enough data to support microplastics does not cause precocious puberty? We do not. We have good data that says that it'll vary on the amount of plastics, but what about how people process plastics? What does that mean? How much is too much? We don't know that answer. So when it comes to areas that we don't have all the information, but we have an idea, it's now our job as a consumer to make the best choices that don't cause us to stay awake at night. So to use that example, I have a daughter, I have a son. I don't want my daughter and my son to go through precocious puberty if they don't have to, right? And so when I look at plastics, I'm going to reduce my plastic threshold by maybe using non-plastic food containers, right? So we use a lot of glass bowls, versus plastic. I use stainless steel plates and cups now instead of plastic because those are things that my kids are using every day, right? And so I tend to lean towards stainless steel, tend to lean towards non-plastic, but I'm not losing my mind over like the one thing that my kid may use or that they touch a plastic toy. Because if I were to do that, I wouldn't sleep at night. So as a consumer, you have to think about, here's the information I have, here's the money I have, that's a resource. How am I now going to make the best decision? There's a lot of families that aren't able to buy the fancy plates and the fancy this and that. Am I worried that their kids are going to be loaded with toxins? Not necessarily, but they're making the best choices with the information and resources that they have at the current moment. And if guidance changes, of course, we're going to sound the alarm. But at this point, I am not worried of all these things. And to the point about food, you don't have to eat organic. If organic means a lot to you, that's great. But I would try to eat fresh fruits and vegetables. I'm not going to sit here and say that eating a diet of packaged processed foods is good for a child. Absolutely not. But am I worried if my kid eats Annie's cheddar bunnies or goldfish or like Teddy Grahams? No, because I know that the majority of their diet is fresh fruits and vegetables and home cooked food. And so look at it as balance.
The food is hard because we don't want to shame parents for whatever they're able to feed their kids because we know at any age, fed is best.
Yes.
But there are some basic guidelines. And of course, we also don't want to make our kids feel ashamed about what they look like. Can you tell us quickly, what's the best way? If there were a child sitting in your office and you were concerned about their weight, what is a healthy, pragmatic way to bring that up? And what would you say to the parents about what is doable and what we're trying to do with nutrition?
I love it. My like TLDR or TLDY or whatever, no, didn't watch, TLW, would be to make sure that you are not putting foods on pedestals or vilifying food. And what that means is, of course, yummy, like packaged foods and sugary foods taste good because, oh my gosh, they're just satiating. Let's not deny that. What we don't want is to put it on a pedestal and say, oh, finish your dessert and then or finish your food and then you can have a donut. Finish your food and then you can have this. We want to bring that down to an even playing field with all other foods. So I don't call any of those food treats. It's not like you're going to get a treat. Like sugar foods, packaged foods are not treats. They're just part of life. When my son sees that in his lunchbox, I rotate it in with apples, with, fresh nuts. He's 6, so he can eat nuts. I rotate that in, and it's not this big production that he got a cookie. It's, hey, you got a cookie for lunch. So I put it at an even playing field. If a child is binge eating foods that are like obviously the sweets and the packaged foods, it's about how can we now incorporate it into their meals, but also put other foods into their diet. It's talking with a nutritionist about, again, meal planning so that we're not removing those foods from their diet. You cannot just cold turkey remove the sweets. You have to kind of say, okay, we're going to have this maybe with dinner instead of after dinner, or we're going to pair it with a snack with like a string cheese versus, a reward system. So keep everything at a level playing field. Don't put any food on a pedestal or as a reward. And I also do not vilify food. So if we go to a party and my son sees the cupcake table, he gets free reign.
Go for it.
The cupcake table, meaning obviously I'm not going to let him eat all the cupcakes because he has to keep it for everybody, right? But I'm like, okay, if like the host is allowing people to have more than one, I'll say, Ryan, listen to your body. When you're done, you can stop. And because we do that, he will stop, right? He'll eat 2 and be like, Mommy, I'm done, and leave half of a cupcake. And that's how I know what we're doing is working, and that I haven't created this binge eating mentality that he sees sugar and he doesn't know what to do with himself, which is what I was raised with. I was raised with it was a reward. And so when I ate sugar, I would scarf it down. And that's an unhealthy relationship with sugar. So now I know how to have self-control, and my kids have the same thing because they like it. We don't create it as a pedestal, and they go to parties and they're like, I'm done, mommy, you can finish it off. And I'm like, that's how I know it's working.
Random question that a parent asked, can kids get white hair?
I love this random question.
2 middle schoolers in my kids' circle of friends had white hair, and there was such concern, or is this just funny, or wait a minute, is something wrong?
So absolutely, anyone can get white hair, and it can be genetic. Obviously, extreme stress can cause it, but a little gray hair, white hair is not a concern. If they have a patch of hair loss, if they have a huge chunk that is coming out of the hair that's just white and they didn't dye that, could be a concern of some genetic syndromes, but that's stuff that we would have seen earlier. So I'm not concerned. We shouldn't point it out as a bad thing. We can maybe say, oh, that's cool. It's just who they are, but it's not a red flag. I'm more concerned about the huge patches of hair loss, rapid weight changes. Obviously you have a whole section that's grayed out, white out, and nowhere else. That can be a concern.
Okay. What about traveling with babies? I know, a lot of babies are born, they have older siblings, families want to travel. Holidays obviously are a concern, but we're always getting together, right? Play dates, going to daycare, going to playgrounds. What is a safe time for new babies to be sort of introduced to the world at large?
I love it. And the answer to that has to do with understanding how their immune systems work. Obviously, a 4-month-old immune system isn't perfect, right? But under 3 months, a baby, when they get sick, it's more of a concern, one, because their bodies are smaller. And if the sickness leads to fever, it can lead to more of a concern. So the reason why I use 3 months as that marker is not because at 3 months, all of a sudden their immune system is this magical, amazing thing. It's that with illness can come fever. So under 3 months, if your baby gets a fever, it's a concern because of just their way their body's developing. So not all viruses are going to cause a fever in a baby, but if it does, that is the reason why I'm concerned. So I always say 3 months, we want to be extra precautious. We don't want to be around sick visitors. We want to avoid indoor crowded places with poor ventilation. So think of churches, temples that are like stuffy that you can't really, air circulation's poor because that's how germs can spread. Airplanes, I'm not against airplanes if it's a must. I say that because I've taken care of a lot of families who've adopted babies and they have to travel back in the first 3 months. People can look at the baby. People can look at that baby and family and be like, how dare they get on an airplane? You don't know the reason why that family's traveling. This isn't like you can't travel with a newborn. It's understand the risk. Maybe you got to go. And again, benefit risk, then go, right? Keep them close to you, travel. But generally after 3 months, you can be a little more lenient, but you still want to take precaution, right? Hand hygiene, avoiding random kisses from strangers, random kisses from family members who may be under the weather and claiming that it's allergies. That's going to be important.
Do you think parents can tell family and friends, please just don't visit for the first month, 2 months, whatever it is? We're justified, right?
Absolutely justified, but also use what you want to do. Like, I'm going to be honest, when I had my son, we went through a very traumatic delivery in December that I wanted the social interaction because I needed company for my mental health. As a pediatrician, I didn't create any rules of don't come because I was craving social interaction. What I did say is wash your hands. And if you're under the weather, wear a mask. Right? That's the rule. And right. I say that because, again, it's not black and white. You cannot have visitors. It's what makes sense for your well-being. But if you don't want the visitor, blame the pediatrician. If you don't want to,
we will do it.
Yourself.
Dr. Mona said.
You say, my doctor says that it's best not to have the visitor, but think about what is best for you socially and emotionally. And if you don't want the visitor because you just don't want them or you're worried about risk, wait. The baby is there, right? Like they can see
it feels so good to have someone say, do what the mom needs above anything else.
And I'm not even looking at the baby. You hear my answer? It's like, what do you want? Do you even want the visitor? Like, if you want the visitor like I did, we can always take precaution, right? In the COVID pandemic, when it was the peak, all these moms were coming in and they're like, listen, I'm lonely and I want my friend to visit. I'm like, let them visit. You're not going to spread a virus if they're in good health. Wear a mask if you're concerned. Wash hands. But if you want your bestie there with their toddler and their toddler's in good health, enjoy it. Like, the benefits have to outweigh the risk of any decision we make, whether it's about vaccines, visitors, taking a trip. And so if your brain is like, I'm going to be more stressed than feel relaxed with a visitor, that means you're not going to have the visitor, right? And hand wash, cover your mouth. You can't live in
And
a
do you have
bubble.
another tip for us? Saline, something so easy and so accessible.
Look at
Tell
me
us
right
about
now.
it.
So I'm recording this video with a head cold, and I brought my saline because it's my bestie for life right now. Saline is something that I think is the underrated MVP of the cold and flu season. Okay, there has been some studies with hypertonic saline. Hypertonic saline is 3% saline. It's very salty, but if you use hypertonic saline at the first sign of an illness, it can reduce the duration of the viral, like a cold, and also throughout the illness. Now, some
Is this
caveats
safe for kids too?
so some caveats to that is hypertonic saline can be it can burn because it's very high in salt content. So I wouldn't recommend it for newborns and babies if they have some congestion. You would just stick to the 0.9%, which is the standard one that you get at the drugstore, which is in my hand right now.
Okay, so 0.9% saline
Is your standard.
is safe for everyone.
Newborns, yes. And so when you have any runny nose, you don't need to go digging in there with a suction, but any runny nose, use saline, let it liquefy, let it drain. If they're super stuffy beyond that, bulb suction, the suction tools to get the mucus out. But
Yeah, do those work?
You don't need to. Like I've only suctioned my kid once. With a suctioning tool, because otherwise you can just drop saline in there and put it up their nose, let it
A couple times a day. How much do you recommend?
Saline can be used as often as you want. So whenever you notice stuffiness, I'm literally walking around with this and like sniffing it all day. Like there's no max because it's saline. It's not medicated. It's just salt water. It's like using the concept of like if you were to go to the beach when you're sick, the salt water, people say, well, I went to a salt water and it helped. Because it's salt water, right? Like it helps to be around salt solution because salt can thin mucus, it can reduce viral replication, and it can also help thin the lubricate the little cilia in the nasal passages that help move viruses out. So it has so many benefits. Honestly, if you don't have saline in your house, you are missing out. It's cheap, it's affordable, right? It's a go-to. It's not medicated. It's like literally, I just went and bought more because my
next trip to the drugstore, that's what we're getting.
Yeah, and for your babies, use it if they're sick. You don't need to use it if they're not. And then anytime a toddler, you make sure you start using the saline at the first sign of illness.
Okay, Dr. Mona, we could talk to you all day. Is
love
there
it.
some thought that you want to leave us with, though, when it comes to just the way we think about our kids' health or your philosophy about being proactive and involved rather than just going along with what any doctor tells us? How can we play the most proactive and helpful role in raising our kids and their health?
I think my advice here would be always to zoom out in any decision that you're making. I think it's so easy to fall into minutia, and I appreciate that of every decision. I need to do my research. I need to do that. But at the same time, you have to also respect that you may not be an expert at everything. Parents are the experts at their own children, but using vaccines as an example, I do not expect a parent to know everything about vaccines. I expect you to find someone you trust to help guide you through that decision making. So maybe it's someone you find online that makes you feel empowered. Maybe it's your pediatrician. It hopefully is someone who's an expert in the field that you may not be an expert in to help guide you. Who can I delegate this out to? Meaning, who can I talk to that knows about this area? Who can help me make a decision so that I'm not carrying that mental burden, that emotional burden, the physical burden of all that it takes to raise a child, and use that system wisely. These people should be knowledgeable in the areas that they're knowledgeable in. They should be uplifting realists. I use that term. It's a coined Dr. Mona term that says these people shouldn't be like, everything's great, you're amazing. This person should be, hey, I notice you're struggling. I know this is hard. What can we do to make it better? Someone who understands the situation and is going to lift you out of it with help versus a negative Ned or toxicity, positive toxicity, right? Use that people. These people should be in your world, and you should seek these people out to make your life better. And zoom out, know what you're looking for. When you're getting worried, think about the big picture when it comes to vaccines. Am I doing the benefit outweighing the risk? Plastics, is the benefit outweighing the risk? Always look at that versus getting caught into, oh my God, my kid touched a piece of sugar or my kid touched plastic and now they're going to end up with X, Y, and Z. That's not how the body works. And that's not how we can navigate life with children.
Dr. Mona, thank you so much. You are uplifting. Thank you so much for your vulnerability as a mom, and we're cheering you on in your career. And also, thank you so much for your science-based information.
Thank you so much. This was an honor. I agree. We could have talked for a long time. I love the hodgepodge.
We're just going to have you back. That's all.
Thank you so much. This is great. And I'm happy that we could chat today.
Be well. Thank you.
Thanks.
Moms, we're so grateful you're part of our community. Don't forget to rate and review Momcast to help us spread the word, and follow us on Instagram at the Local Moms Network. I'm Dimitra Ganyas. We'll find you back here next week from Stanford Studios.